Hi everyone, this is Keen, and I will be going over the neurocognitive condition of delirium. What is delirium? Delirium is characterized by a disturbance in level of awareness and a change in cognition that develops rapidly over a short period of time. There is a sudden change in mental status with a patient, which occurs rapidly and is usually temporary. Delirium often reveals an acute underlying medical condition and typically resolves itself when the underlying cause is resolved. Delirium is combined with memory and language deficits. Delirium affects approximately 20% of adults in acute care facilities such as emergency rooms. Delirium most impacts populations that include older adults, those undergoing medical procedures such as surgeries, and AIDS and cancer patients. Most people fully recover from delirium within a few weeks. Medical conditions related to delirium include dementia. 50% of cases of dementia involve some type of temporary delirium, drug intoxication, poison, and withdrawal from drugs, underlying infections, head injuries and several forms of brain trauma, sleep deprivation, immobility, and excessive stress, nutritional problems such as dehydration or malnutrition. Symptoms of delirium include difficulty sustaining attention, extreme distractibility, disorganized thinking, speech that is rambling, irrelevant, pressured, and incoherent, impaired reasoning ability and goal-directed behavior, disorientation to time and space and place, emotional instability, impairment to recent memory, disturbances in level of consciousness with interruption of sleep-awake cycles, psychomotor activity that fluctuates between agitation, restlessness, and a vegetative state. Autonomic symptoms of delirium include tachycardia, sweating, a flushed face, dilated pupils, and elevated blood pressure. It is important to remember, in delirium, it is common for symptoms to fluctuate throughout the day. There may be periods of time where no symptoms are present in a patient at all, and then there will be periods where some or all symptoms are present. When diagnosing a person with delirium, it is important to observe the 5 criteria that is laid out in the DSM-5. A disturbance in attention and awareness. B, the disturbance develops over a short period of time, usually hours to a few days, represents a change from baseline attention and awareness, and tends to fluctuate in severity during the course of a day. C, an additional disturbance in cognition, memory deficit, disorientation, language, visuospatial ability or perception. D, the disturbance in criteria A and C are not better explained by another pre-existing, established, or evolving neurocognitive disorder, and do not occur in the context of a severely reduced level of arousal, such as a coma. E, there is evidence from history, physical examination, or laboratory findings that the disturbance is a direct physiological consequence of another medical condition, substance intoxication or withdrawal, exposure to a toxin, or is due to multiple etiologies. When diagnosing a patient with delirium, it is important to identify what the cause of the delirium is. Is the person possibly intoxicated? Are they drunk or high off some type of a substance? It is important then to note that the cause of the delirium is substance intoxication. The person could potentially be in withdrawal. Have they stopped drinking alcohol and are now, hallucinating, or their speech is slurred due to withdrawal of some type of a substance? Is the delirium due to another medical condition? Is the person HIV positive? Did they get tackled in a football game and could potentially have a concussion that is causing the delirium? Or is the delirium due to multiple etiologies? Is the person potentially in withdrawal and has HIV? Could there be something that has predetermined multiple things that have made the person more prone to having this spout of delirium? Also, when diagnosing delirium, it is important to identify if it is acute or if it is persistent. Is the person experiencing delirium over a few hours or days, or has this now been lasting for weeks or for months? Is the person's mood hyperactive? Is the individual agitated or refusing to cooperate with medical care? Is the individual hypoactive? Their level of psychomotor activity may be accompanied by sluggishness, or they're lethargic, they want to sleep, they might be stumped over and answering your questions very slowly. Mixed level of activity, the person is up and down. Their level of activity fluctuates from talking very rapidly to being extremely sluggish. Conclusion: when diagnosing a patient with delirium, it is extremely vital to understand what the underlying cause of the delirium is in order to be able to diagnose and treat the patient appropriately. And in order to know that, it is vital to understand the DSM-5 criteria. Thank you.